We're excited to welcome Dr. Kirsten Nicholas.
Good morning and a warm welcome from me. So I'm very excited to be here again in Austin. So it's just for me coming home every year. So I have to thank Cindy, all the volunteers and the organizer of this conference inviting me, and it's always really a pleasure coming over and to have opportunity to give some presentations. Thank you very much. So my today's aim is to give you an overview about our approaches in Germany in treating, diagnosing and treating of Morgellons patients, and I have no conflicts of interest presenting here in Austin. So just to give you an overview what we are in Germany, so the BCA-Clinic has meanwhile running 4 different departments. So the clinic itself to take care for the Lyme and Morgellons patient. We are running a routine lab for all the specific diagnostic. And since 7 years, we have set up a research center, meanwhile with 3 scientists, 2 master students, and a lot of lab technicians to go forward in research. And since some time, we have also established the BCA Academy to train especially doctors from everywhere from the world. So we are the only training unit outside of US of ILADS. So it's a very big honor for us. Actually, we have 44 employees in Augsburg, 6 physicians and 3 additional nurse practitioners, and a lot of other stuff. In the past 11 years, we have treated more than 26,000 patients, which is quite a high number. And since 2007, I'm taking care for Morgellons patients as well. So meanwhile, I've treated around 1,100 patients diagnosed with Morgellons disease. In my today's presentation, I want to give you an overview regarding specific diagnostic and testings of Morgellons disease. Then this includes also a short overview about the typical symptoms and complaints patients show up with. And our treatment strategies, so in 2 different manners, so the conventional types of treatment and alternative or integrative treatment approaches as well. So let's get into the today's presentation. So when patient will come into my consultation, it's always necessary to get all the important information about their medical history, so the so-called anamnesis. Part of this first consultation is also an inspection and physical examination. In all patients, we are using a dermoscope, especially in the Morgellons patient, to find out or to confirm presence of potential fibers or other skin issues. And we put all these information into a specific database, even for research reasons later on. Also included is a good form of diagnostic, so we are able to offer all the specific lab testings in our own lab, which is accredited and certified since more than 10 years. And afterwards, if necessary, we also go for other specific technical examination if needed. So most of the patient will get an ultrasound of the abdominal organs, will get an ECG. This is not so far for diagnostic reason. It's more to see if there's any influence later on by the decision to go on specific medication. You know, some of the antibiotics could show up with some risk, and therefore we need additionally examination types. In specific cases, sometimes there's also a need to go for more specific technical examination like MRI scans, SPECT scans, and so on. In collecting all the data, we go on standardized checklist. So every patient is asked to fill out a specific questionnaire to get an overview about all the health issues in the different organ systems. We have also launched recently a new tool which we call a multi-infectious disease prediction tool. So this is a specific algorithm. Patients have to fill out only a one-pager, and based on this information, we can predict in around 85 to 90% which possible infectious disease could be part of the problem. So there are the most known strains of Borrelia included, and the possible co-infection as well, the bacterial ones, the parasitic ones, and the viral ones. This is very helpful, and that could save a lot of money not to go to a wide bunch of testing, even to be focused on the most likely ones. And we also add a specific assessment questionnaire to get more and more information about possible inflammation, which is also one of the major parts of chronic illnesses like Morgellons. So for the lab test of Borrelia, so most of our patients, and this is the same what Dr. Safely has presented this morning, we see most often in patients with Morgellons disease Borrelia, mainly Borrelia burgdorferi, but also the other closely related species like Pfsaelii, which are the ones causing certain skin issues, and Borrelia garini, which are mostly responsible for all the very severe neurological issues, neuropathy, paresis, and so on. Beside that, Bartonella is one of the challenges in Morgellons disease, and we have also found a lot of patients presenting Chlamydia Pneumonia infection. So I can say today that minimum of 85% of patients showing up with positive findings in the Borrelia testings will also be positive for Chlamydia Pneumonia, and mostly in form of a reactivation, means based on IgE antibodies. I guess, can we go for the question later on?
What's that? That's not material?
Sorry?
Do you have any incidents of corresponding cross-reference with Pseudomonas maltophilia?
No, we don't. So far. Also in some of the patients, we have seen the typical other co-infection from the group of tick-borne diseases like Ehrlichia, sometimes the parasitic ones, Babesia. It depends from the areas where patients are coming from. So what type of a diagnostic regarding Borrelia could be indicated? So at first, the normal serological testing like ELISA and the Western blot. I guess everybody of you will know about the challenges of going for serological testing. So ELISA is lacking of sensitivity. It's relatively specific, but lacking of sensitivity. The Western blot is it's a bit better, and C6 peptide the same. In our lab, we are going always additionally on what we call cellular testing. This is the so-called ELISpot or Lyme spot test. This type of testing could be more seen as a good staging parameter. These tests are very sensitive regarding Borrelia, viral and other bacterial infection, and giving us a lot of interesting information where patients are before starting treatment, under treatment, and after treatment. We always include a CD57 NK test to get some information regarding chronicity. And if needed, we are able to go also on Borrelia DNA PCR testing, and we are very delighted also to offer Borrelia culturing since a long time. For the Possible co-infection, we have to be aware that they are very often found in Morgellons patient, so especially Bartonella and Chlamydia, but sometimes the other ones as well. And based on different areas where patients are coming from, you should also sometimes include parasitic infection like Babesia. So actually, based on the newest epidemiological data, Babesia is going forward. That means in most of the European countries, more than 40% of the ticks are carrying, meanwhile, Babesia as well, which is definitely a big challenge. In the eastern part of Europe, you have to be aware more and more of possible worm diseases, but I do not have any clue how widespread that will be here in the US. So for viral infection, could we also have some influence regarding specific health issues? As you know, one of the major symptoms is chronic fatigue, and chronic fatigue is mostly also linked to onset of some viral infection like EBV and others. This is something you should definitely be aware of and include in the differential diagnostic. So mainly we see problems in our patient based on EBV, cytomegalo, and Coxsackie virus. In more rare cases, we have also found Toxoplasma and Parvo B19 infections. For the differential diagnostic, it is also important to confirm or to rule out other health conditions like rheumatic diseases, autoimmune diseases. A big issue is based on inflammation. So what Rich Horowitz is calling the big 3 I's: infection, inflammation, and the immunosuppression are part of the problem, and I will figure out a little bit later in my presentation. Toxicity could be an issue, as well as endocrine dysfunction. And to have a good overview about all these problems will definitely lead to much better outcoming results regarding treatment later on. So let's talk about a bit the different symptoms and complaints. I don't want to go in very details because Ginger has pointed out the most often findings. But nevertheless, so in acute stages, a patient will very often present spontaneously appearing, slowly healing skin ulcers and may have itchy, crawling, and stinging sensation in their skin. If you go on the dermoscope examination, you will find the filaments or fibers in the skin lesions, under the skin, and in other parts of the body. And the fibers and filaments, as you know, could be multicolored. Additionally, in chronic patient will present a lot of other different and very often severe symptoms. So part of Morgellons disease, definitely chronic fatigue and very severe tiredness. Many of the patients will show up with poor sleep and other with other sleep disorders. So it depends of the infection, which type of poor sleep it will cause. Bartonella is well known as inducing problems to fall asleep. So patients are very tired, but they can't fall asleep. And Lyme disease, Borrelia infection are causing a bit different problems. So these patients have a lot of awakenings per night and then having problems to fall asleep again. Or you can see both if there's a combination of the certain infectious diseases. Cognitive dysfunction is a major symptom, and we also see a lot of behavior or other mental disorders, but not in the sense of delusion, sticking parasitosis. I don't believe in that. Here you can see some pictures. So when we go for the examination and medical anamnesis, so some of our patients could remember that they have an erythema migrans or bullseye rash, or what we call an lymphocytoma at one of the ear labs, for example. This could be a typical finding in the history before. Here are some more pictures, and at the right side of my slide you can also see a typical skin condition of chronic Lyme, which is called the ACA, the Acrodermatitis chronica trafficans, which is a very common finding in Europe because we have a lot of problem with Borrelia afzeli infection. This is a bit different as to the US, but could be very helpful finally to get the diagnosis. If you see ACA, this is in some kind of 100% confirmation of having chronic problems with Borrelia infection. Okay, now let's talk a bit about possible treatment options. So in our clinic, we are running a more holistic approach, so based on 8 different pillars, as you can see. You know, so one of the pillars is a very important pillar, the antimicrobial treatment. Others could be the change of diet, other support with dietary supplements or detoxification, support with other medications. Good pain management is a very important approach. We also start with some exercising treatment, stress management, and finally some mental support, which I will explain a bit later in my presentation. So let's be focused first on the first pillar, means antimicrobial treatment in Morgellons disease. So that means the use of possible antibiotics, or antiparasitics, antihelminthics, antivirals, and antifungals. When we start treatment, it will show up which type of medication is needed. If we are at the beginning focused on Borrelia, there's another important point we have to react on. These are the different pleomorphic forms of Borrelia. You know, the reason why we have to go on certain combination is mostly based on this. So in acute stages, which you can see on the left-hand picture, mainly the problem is only based on the original spiral keyed form of Borrelia. But under stress, so in vitro conditions, and that was also well proven meanwhile by the University of New Haven, so under stress, Borrelia is able to change their shapes via blebs, round body forms. Another problem could be also be on so-called biofilm formations. And these are different survival mechanisms of this type of bacteria, which could lead to certain problems later on in treatment. So Dr. Safely has just mentioned that she has seen a better response on what we call beta-lactam antibiotics. Means these are the penicillicins and the cephalosporins. The reason for that is now seen in this slide. You see on the left-hand side what we call cell wall antibiotics, and this group includes the beta-lactams like penicillicin, amoxicillin, and all the cephalosporins. So this type of antibiotics isn't able to target and to kill the other polymorphic forms of Borrelia, like the round bodies or former cystic forms. These types are not able to reach the intracellular space where Borrelia could be very often hidden, and so that needs different approaches. Means we try always in our patient to individualize or the treatment approaches as best as possible. That means based on on our knowledge about the different polymorphic forms, we try to combine antibiotics, which will be definitely able to take care for all the different shapes. And this indicates sometimes to go on combination of cell wall antibiotics and the antibiotics for the round bodies and cystic forms, basically stuff like metronidazole or tinidazole, or what we call the antimalarias like Artemisia, hydroxychloroquine, which is the Plaquenil in your country, and the Atovaquone, for example. A very important treatment could be based on the intracellular antibiotics or antimicrobials. So one of my favorites are always the macrolides, the quinolones, tetracyclines, and the antituberculostatica are going more and more in the focus regarding latest publications. So it seems that this group is doing a great job for many of the tick-borne diseases, and this is definitely part of the problem of Morgellons disease as well. So the takeaway message is that is definitely necessary to combine certain antibiotics to get really good outcoming results, and there are a lot of reason to go on specific combinations. Let's talk in the next minutes about a bit on the additionally co-infection, which are part of the problem in patient having Morgellons disease. I don't want to go in too much details, but just to mention it. So, you know, some of the co-infection could be transmitted by ticks or by other biting or sucking insects. And you see here the group of the typical ones like Ehrlichia anaplasma, all the rickettsial infections. Bartonella is part of this group. Babesia is a parasitic infection, and some of the viral infection as well. So there's another way of transmission for other co-infections. These co-infections are mostly transmitted by air, ingestion, via sexual contacts, transplancental or other pathways. And so the reason for that is that Borrelia is able to downscale the host immune defense, and that leads to a much more open respiratory tract, and this could be the explanation that many of the patients having problem with Morgellons disease show up with viral infection like EBV virus, like Coxsackie and megalovirus, and so on. This is definitely a very important point to take care for. So again, some information about one of the most often seen infectious diseases in European Morgellons patients, so Chlamydia Pneumonia. As I have mentioned at the beginning, so 4 of 5 patients I have seen have definitely shown up with acute or mostly reactivated Chlamydia Pneumonia infections. And this is an airborne transmitted infection which could make a lot of trouble. So, you know, you see the symptoms are partly overlapping with the typical Lyme symptoms, but they have also presenting some very specific symptoms, so sinusitis-like problems, very often chest pain and thorax pain, and additionally, and this is opposite to Borrelia, these bacteria will very often cause heart rhythm disturbances in the sense of tachycardia and tachyarrhythmia, while Borrelia is doing mostly the opposite. I don't want to go in more details, just to mention it. So the diagnostic is also very similar. We have good serological tests. We have the cellular test for diagnosis, and if needed, but this is a very rare approach, we can also go on PCR testings. The treatment is very similar to the treatment of Borrelia. As there are many of these bacteria intracellular, you have also to combine certain antibiotics to get really good outcoming results, and typically we use macrolides, tetracyclines, and the quinolones for chlamydia. One of the biggest challenges from my point of view is definitely, and I'm totally agree with Dr. Safely, is Bartonella. So based on my experience, the best results are based on Bartonella schemes. This is a very important information. For these types of bacteria, you need a certain combination of antibiotics later on, and the reason for that is that most of the tick-borne diseases are so-called intracellular bacteria. If you go for the typical beta-lactams, they have no chance to reach this protected environment, and that leads to completely different approaches. The problem with Bartonella is very complex because this type of bacteria can really make trouble in many different organ systems. So at where the whole nerve system, so the central nerve system as well as the peripheral nerve system, they can also get access to the autonomous nerve system and the cranial nerves as well. So causing a lot of neurological issues, so like neuropathies in a very severe form, even more severe than we have seen that in patients with Borrelia. On the other hand, you can also see very severe other neurological pictures, so seizures or seizure-like problems in patient, and anxiety is one of the major symptoms, panic attacks and other psychiatric health conditions. Bartonella is also very present in any part of the skin, causing the Bartonella-like rashes, which could be predominant in some patient. If you see these specific rashes, the diagnosis is going much easier than in the serological testings. And other organ system could be also affected, so all parts of the eyes, very severe gastrointestinal issues in the sense of typically nausea, some vomiting, and abdominal cramps, and so on. So the treatment is a challenge. There are good approaches based on an antimicrobial group called the quinolones, but mostly we decide for a specific combination based, for example, on macrolides, on tetracycline, on the tuberculostatics like rifampicin and others. And for Bartonella, sometimes a good option could be also be to go on the old-fashioned sulfonamides if the rifampicin isn't good tolerated, for example. In general, the antimicrobial treatment could be based on conventional antibiotics. So if there's any need due to the clinical pictures, we can add also some antifungals because patient could show up with fungal problems as well. So there's a huge bunch of different available medication. And especially at the beginning, but this is also still guilty, some of the patients are responding very, very well on the group what we call anthelmintics or antiparasitics. So, there's no real explanation so far. So especially at the beginning, when we didn't have any clue exactly what Morgellons was, we tried these different approaches, even to include all possibilities in treatment. But nevertheless, the anthelmintics like ivermectin and some others like albendazole could sometimes make really great job and very supportive and beneficial for patients. So in the rest of my presentation, I will also present to you some different alternative approaches. So meanwhile, I'm very experienced. I'm a conventional trained physician, but I learned I experienced very early in my professional life that only based on conventional medicine there was something lacking, and so I had to learn a lot, especially starting in the mid of the 90s, and so meanwhile I think I have a really good overview and experience with these alternative approaches, and Germany is typically very common for naturopathic approaches, homeopathy, and so on. And we have started very early to include these approaches in our treatment, and I can tell you at this point very successful, I guess. So I want to introduce you in some of these approaches, which are very common meanwhile and could be used instead of the conventional antimicrobials or together with them. And the aim of using herbal antimicrobials is definitely the same. So based on the use of this stuff, it will be possible to eliminate all the bacteria like Borrelia and the potential co-infection. And there's another advantage of running these herbal compounds. You have additionally support for your immune system. Many of the herbals have good additionally anti-inflammatory effects, and at least some of them can induce what we call repairing processes. That means some of them are starting repairing processes in the nerve system or in other tissues, and that is very beneficial and supportive, at least. So many of the herbal protocols are well known, especially in the US. There are many options to go for. So we have started very early to introduce also the American protocols, even to find out how they are working, and some of them are pretty good. We have only one problem, and this is a legal problem. Unfortunately, none of the American producers have ever tried to officially list their products in Europe, and so that was the reason that we could use the stuff only in officially studies, not in general offering these to patients. For this reason, we started early to find alternative solution, and meanwhile we have good options also to treat legally our patients in Europe. So one of the protocols we are using is the so-called MD Plus protocol, and another one which is called the M protocol. And now I want to introduce you in these types of treatment. So this is a typical protocol called Morgellons Plus. If you're interested, at one of the booths, you can get the original protocol with all the additional information. So MD Plus means that we include herbals with good antimicrobial effectiveness, which you can see on my next slide. So this is a combination of 6 different herbal extracts. All of them are pretty well known as being very effective to target and to kill bacteria, viruses, and parasites. We combine the treatment with another combination of Artemisia and monolaurin. Artemisia is part of the antimalarias, but is doing a good job not only regarding possible parasitic infection like Babesia. So in many other studies, it came up that Artemisia has good antiviral effects and some additionally antibacterial effects, and it is definitely worth to include Artemisia in many different treatment approaches. And this is what we are exactly doing. So if someone starting with antibiotics, we always include one of the antimalarias, not only again to include a possible parasitic infection like Babesia. So Artemisia and some of the other antimalarias could also make a good job in the intracellular environment. If you go constantly on these medication, you will see a shift of the intracellular pH value. That means the intracellular milieu is getting more basic, and this is definitely a big advantage because this is supporting the transfer of antibiotics into this environment. On the other hand, germs do not feel very comfortable anymore, and they try everything to escape. And outside of the cell, they are leaving the safe area. It's much easier to target and to kill them by herbal or conventional antimicrobials, for example. So part of these holistic treatment approaches are also including some detoxification, and this is also something we start with all patients. It's not at the beginning a very intensive detoxification. You know, you have to be aware if you're going on too much detoxification that could have influence on the use of antimicrobials. So there's always a chance of washing out. So on one hand, you are going for very expensive antimicrobials, and if you go on too much detoxification, you will wash out the antimicrobials via your renal system or via your liver out of the body. It doesn't make sense. But a mild support is definitely recommendable just to protect other organ system as liver, as the renal system, means the kidneys and some other organism as well. So this is a good bunch of herbal medications, so based on some chlorella, some nettle, several berry extracts, sage, beers, garlic, and turmeric to give a patient the needed support and not to get an overload by the antimicrobials, for example. Recently, we have introduced in the MD Plus protocol a new herbal compound based on Nigella, on gotu-kola, and vitamin B5, which is the pantothenic acid, to give patients some more support for the skin lesions. And this is pretty well working. We are actually also introducing some external compounds for the treatment of the lesion, and this will be available very soon. So we are actually running the evaluation of these products, and hopefully patient can get this very soon from local pharmacies. Another approach is based on what we call the M protocol, and that had nothing to do with Morgellons disease. So this finally only a working name. So, you know, meanwhile, I'm very experienced with the use of herbal extracts, and this is exactly one of the protocols I have started with at the end of the 90s. So unfortunately, this is not in general available via supplement stores. So there had been a change in Germany of the legal situation, and the herbs I have determined to be is very effective, which you can see on my next slide, are meanwhile known or accepted as real medication. So they are not free available via any supplement store. So you need doctor's prescription in Germany, and then all pharmacies are able to provide to you these protocols. So I can't tell you if that would be available somewhere in the future here on the US market. So this is mainly for European patients, but also very, very successful. So you see here different herbal compounds. Some of them are similar to the MD Plus protocol, but here you can see a bit different approaches, which are also very well running, and we have seen really good outcoming results. So for other symptoms or ailments, we can go for many different other herbal extracts or compound. And so I've mentioned the topical treatment of the skin lesions, or if there's any need to support other organ system, it would be possible even based on naturopathic remedies. And if there's a need, for example, based on mold or intoxication, we can also intensify this type of treatment. So let's talk in the last minutes about the other pillars of our holistic approach. So Ginger has also mentioned you have to change your diet as getting really successfully results finally, and this is exactly what we are telling our patient as well. So there are different approaches of specific diets. So mostly we recommend so-called anti-inflammatory diets just to give some additional support, but there are different other types also available. For example, what we have learned is that many of our patients are lacking of vitamins and minerals. This is a sign of chronic infection, chronic inflammation, and other chronic health condition. There's some influence on the small intestine. That means a problem later on with absorption, and I guess that is the reason of all the lacks of vitamins, minerals, and other stuff. And so before starting treatment, we always suggest to go on some lab test, even to find out if there's any need for additionally support. Other support could be based for what we call Herxheimer-Yage reactions. So there are also some good herbal compounds available, like the Siberian ginseng or quercetin. Could be supportive for patient starting with herxing, and basically one of our targets is definitely inflammation. So with the new generation of cellular testing, the so-called Lyme spot test, we are able to get also information regarding onset of local or general inflammation. And this is something which can bother patient in the same way as the chronic infection. And we have learned that some patients are really happy with additional anti-inflammatory support to downscale the local or general inflammation finally. So you see some other examples to support patient with brain fog, with a poor sleep, and probiotics. If you have some more question, feel free to contact me later on. So I will be here until the end of the conference, and I'm happy to answer all your questions later on. So, there are also some other very severe health condition where you need some additionally medication. So we have talked about detoxification or whatever it is. So some additionally immune support and so on. I don't want to go in more details because of lacking of time. One of the next pillars we are going for in our approach is good pain management. Pain is also one of the major issues of Morgellons patient. You know, different types of pain are always seen. Could be based on musculoskeletal pain, but more often neuropathic pain with all the polyneuropathies or neuralgia problems. And this is something you should be focused on. And so I'm always telling my patient, this is another illness you have. And so it should be definitely included in the treatment approach. Our patient, and you know exactly what I mean, are taking a lot of medication with all these supporting masses of capsules, of drops, whatever it is. And but pain management is really something we should be focused on. As you know, pain is one of the biggest stressors for our immune function, and it's definitely a bad decision if a patient are telling me, so I can stay the pain, I don't want to take some more medication. But it's essentially, from my point of view, to convince patient even to accept good pain management, because that leads to better and faster good outcoming results finally. So there's a huge bunch of painkillers, or what we can call co-analgetics from different other substance classes to support patient for the different types of pain, and it is definitely recommendable to go for that. If you have any question, specific questions, so don't hesitate and ask me later on. There are also good herbal options of only just to mention some, like devil's claw, nettle, curcumin and bromelain, and the white willow bark could do a good job. And there are also some complex remedies from the homeopathy side available, which are doing a good job. We always, and this is the next pillar I want to discuss with you, we start, if even possible, always specific exercise in physiotherapy. It's a non-med type of treatment, but we have learned that this is also very, very beneficial and supportive for patients, especially the exercising. And there are meanwhile a lot of publication telling the same in other severe health conditions like cancer or others. So exercising is something which is almost recommendable. You have to be a bit careful if there's a presence of very severe chronic fatigue. This could be a limitation for going for that, but in general we would definitely recommend all of our patients to start on a certain level with some exercising, and getting improvement later on. You can adapt your training levels later on. So stress management is also some of the focuses in our clinic. So we tried also to start with a good stress management, and there are different approaches to downscale mental or physical stress with some specific treatments. So as there were, if there are progressive muscle relaxation due to, according to Jacobson, autogenic training, and some of the Chinese approaches like Qigong and Tai Chi. And there's also an electronic device, the so-called photo treatment, which could be beneficial to downscale the stress. And the last pillar of our approach is what we call the social support. So Ginger safely has spoken a bit in her last slide how important it is that patients will get this support by their own families, by healthcare providers, and most of you have definitely made bad experience with that, and we try everything to give the needed support, to give even the relatives the needed information, what Morgellons is and what is not, even to get a better understanding. And this was, so looking back, in many patients, very supportive to get a better understanding of Morgellons disease finally. And so if even possible, we support our patient with all the administrational stuff in the fight with insurance companies, with other healthcare providers. It's a challenge, as everywhere. I guess you have the same problems here in US as we have in Europe, and especially in Germany. So bureaucracy is really a big issue. Okay, so let's come to an end. So what are the conclusion of my today's presentation? So, you know, the goal of an holistic Morgellons approach is definitely at first to eliminate all the different invaders, means Borrelia and other TBD bacteria, the parasites and viruses, if they are found. Then again, essential is good anti-inflammatory support and good immune support to build up and to stabilize the immune system. Another goal is to minimize possible side effects of treatment, which could be done by some of the supplements and the overall restoration of the homeostasis of the body, and this will definitely lead finally to less times of treatment. But I totally agree, it's not possible to get really good outcoming results in 8 weeks or 3 months. It's unfortunately a long-term treatment, but if you decide for that, you have definitely good chances of good outcoming results. If you are patient enough to stay such a way of treatment. Doing so, you have definitely good chances of really good outcoming results over the time. So here are my references, and some greetings from Germany. This is from my team and myself. Thank you very much for listening to me.